Patients who are chronically ill are more likely to see a specialist.
About 61% of Canadians wait 1 month or more for a specialist appointment, which can lead to late diagnosis or treatment.
The following videos are first-hand statements from patients, providers, and Canadian citizens.
This is exactly why I do the work that I do. My aunt was complaining of stomach pain for months, and no doctor was taking her seriously. She eventually got diagnosed with pancreatic cancer, or what they thought was pancreatic, given 6 months to live, and she only made it to 3 weeks. I was devastated and upset because I was going through my own injustices within the healthcare system. It's taken me 17 years to be diagnosed with stage 4 endometriosis. I'm not saying all Canadian doctors are bad. There are amazing doctors out there, but we do deserve more compassion. To get a proper diagnosis, I had to fly from Canada to the UK and spend $30,000. That is not okay, and we deserve better here in Canada.
%23 of sicker Canadians reported not filling a prescription or skipping a dose of medication due to costs in the past year.
In 2004, I had a big flare of my rheumatoid arthritis, and I had to get on a medication called a biologic. And it's a new class of drugs for rheumatoid arthritis that are a bit of which are a revolution in the treatment of rheumatoid arthritis. But it's also very expensive. This particular drug costs more than $20,000 a year. So I had to apply for Trillium Drug Program, which is Ontario's financial assistance program for medication costs. And it took 8 months for my application to get approved. And those 8 months destroyed my life. I was in intense pain all the time. More pain than I thought was possible to have. Currently, I pay about $400 a month for other medications because I'm in a situation where either I jeopardize my health and quality of life by not taking the medication, or I pay for it myself. And I have a quite crushing debt that I can't really get ahead of.
People with chronic illnesses, generally, require additional care, treatment, and diagnosis as they are more likely to deal with related risk factors stemming from their chronic illness.
Chronically ill individuals, whether they are insured or uninsured, are greatly affected by the negative components of the Canadian healthcare system.
So when I was diagnosed with leukemia at the end of 2017, I spent 21 days in hospital as an inpatient. And on the day I was sent home, my dad went to the pharmacy to pick up my prescriptions for me. And the bill was $4,000 for a 1-month supply of medications. Luckily for me, my employer's benefits covered most of those costs. My husband's benefits also were able to help with the costs, but not everybody is so lucky to have that. Take-home cancer drugs are out of pocket, and if somebody doesn't have insurance, it could cost them thousands upon thousands of dollars, and we're trying to change that. So,
hey everyone, if there's ever been a video that I've wanted you to share on your stories, save, send to everyone you know, ask them to comment and get it out there to the public, it's this one. September 1st, there's a deadline coming that affects most people in Ontario, Canada. The reason is because there's a pretty good likelihood you will lose free eye care from optometrists as of September 1st, coming up. If you are under 19, over 65, have eye disease, diabetic, that's your whole circle of people, friends, family, everybody. The government of Ontario has only paid optometrists approximately $40 for those. And it's been like that for like 30 something years. It's never changed. It's one of the lowest in Canada. Actually, no, it is the lowest in Canada. Optometrists have said that's enough. They're not doing it anymore. They're losing $40 per eye exam to accommodate this program. They've asked for more. Government says, no, we need your help. There's a petition.
Did you know Canada has a different healthcare system for rich people versus poor people? Which, by the way, is completely against Canada's values of equity, fairness, and solidarity. I'm referring to dentistry specifically. You see, the government provides dental insurance for people on welfare or people with disabilities, for instance. But the government doesn't pay the dentists very well. In fact, a lot of the time, dentists are losing money treating these patients. So what have dentists done in response? A lot of them flat out refuse to see these publicly funded patients, which, if you haven't seen my first video, has resulted in people dying. Or, because these people are more likely to miss their appointments, dentists will double book them, meaning if they do show up, they're getting less time with the dentist and likely lower quality care as a result.
Canadians are wanting better care for the chronically ill. It's time for us all to speak up and be in charge of our medical care.